Hello, everyone, and welcome back to another insightful episode of MedSynapse podcast series. I'm your host, Hetli Shah, and today we are diving into a fascinating yet high stakes field of medicine, which is emergency medicine. This specialty demands swift decision making, resilience, and a profound commitment to saving lives under intense pressure. And to help us navigate the challenges of this dynamic field, I'm joined by an expert in this domain, Dr. Ankur Masani. Dr. Ankur is a consultant and head of emergency medicine with over 10 years of experience. With prestigious credentials, including an MEM from the George Washington University and MRCEM from the UK, Doctor has not only excelled in his practice but has also contributed significantly as an educator and leader in the emergency medicine services. So, Doctor, it is an honor to have you with us today and welcome.
Thank you so much. Thank you.
So, Doctor, to start with, emergency medicine is often described as a high pressure, fast paced, and it requires rapid decision making. So, could you share your approach to prioritizing care when faced with multiple critical patients at the same time? And also, how do you manage your decision making process under such stress?
Yeah, definitely. Emergency department is a zone where the patients are coming very the sick, life-threatening emergencies. If I start from the polytrauma to the medical emergency like a chest pain, stroke symptoms, poisoning, unconscious patients, and we have to be on toes for 24 by 7 and be ready with that. So how we are managed with we are making a priority-based management of the patients, triaging the patients according to priority one, priority two, get the first rule out if the life-threatening condition is there or not, stabilizing the patients according to the needs and start the treatment there, get the provision diagnosis of the what is the reason behind in that, and then dispose the patient particularly in their need. Patient required admission, patient will stabilize after the initial management, can be able to safely home discharge to home. We definitely discharge the patient from emergency room. So main junk is how to manage in emergency is the stabilize the prioritize the things in all the conditions and making the clinical pathways. We have a stroke pathways, trauma pathways, like a poisoning pathways, patients and chest pain pathways, and accordingly we stick with the pathways. So how they will manage the things.
Yeah, that's really incredibly insightful, Doctor. And also, it is so inspiring to hear about how a structured and actually a calm approach can make a difference in such chaotic
Yeah,
situations as well.
absolutely. Yeah, and it happened when simultaneously two or three with the life-threatening patients come together with that. And at that time, you have to prioritize what is the which patients needed the first most priority treatment and the interventions, and then according to it, go with the other patients like that.
So it would be a tough situation and a tough call for the emergency medicine physicians as well at that time.
Yes, absolutely, absolutely.
Now, so workforce related challenges are a recurring issue in emergency departments worldwide. So, what are the key workforce related issues you see, and how can healthcare systems address the growing demand for skilled emergency physicians while preventing burnout?
Yeah, burnout is very common all over the worldwide in emergency physicians. It is India or the out of India, the US, Australia, UK, where everywhere is a common thing. Maybe because of the shift works, because of the risk for exposure to various like infection disease, and most important, the violence as well also. And you don't know about unpredictable about the workload. Maybe that today in a shift is coming the two patients, or next day maybe coming 20 or 200. You don't know at what time the disaster is going to be there. So the burnout is a very common thing in emergency physicians, but you have to keep a balance between your personal life and professional lives. What usually we do, advise with a collaborative team approach works. With me, my team members like doctors, nurse, healthcare assistants, even the ambulance crew, all we make it like a team works and prepare with the like that only there. We only we give it in between the give the shifts, breaks, even relax after the shift, give the proper work shifts and everything. How do we balance within this to come out of the challenge of burnout? And
Yes.
regarding violence and other things, important part is the counseling to the all the patients relatives, even you to discuss all the possible things in patients, and how to the not next procedures, next interventions, treatment path of this. pros and cons of the patients. You to counsel them in an appropriate manner. That is a answer to the violence and burnout in emergency physicians.
Yes, actually, it is such so important to even highlight these crucial points, especially
Absolutely.
addressing such burnouts amongst physicians. So it is really important, I
Yes.
feel. Uh,
Yes. Yes.
because a lot of times it is just about the patients and the patient's family, but nobody thinks
Yeah.
about the physicians, what they go through and
Yes.
what burnout they are going through.
Absolutely, absolutely. For the patient, it will be the first time, but for the emergency physicians, it is
Yes.
routine, the routine. So they how to they manage with the team members, they counsel them to prevent all the such issues that ultimately is their own personal mental health.
Exactly, yes, that is really important as well.
Yes,
So now,
yes.
there are so many mass casualty events also happening, or sometimes natural disasters or pandemics.
Mm.
Emergency departments often operate under extreme strain in such situations. So, how do you manage limited resources during such times, and what strategies can emergency department implement to improve efficiency and patient care under such tremendous pressure?
Whenever there is some mass casualty or disaster or some pandemic call out that there, to make it smooth and effective way, you have to prepare it well. You have to make the mock drills, you have to prepare, you have to identify your resources, your team powers, how it works in there, and manpower as well also there. Or you have to prepare all these things. And then you are going to treat your give your response in that. In my tenure, I have seen many mass schedules in disasters whenever there's a road traffic accident or some any pandemics and any floods or something like that, and you have to prepare it yourself first. Then you have to give the response, how you manage, how you segregate the things, your manpower, your pharmacies, your equipment as well, also ventilator support as well also, and then how you get your recovery from that in particular situations. So important is not to treat in a disaster or mass casualty. It is a preparation, the mock drills. So how you prepare yourself for the future thing. And mass casualties or the pandemics or even the what I say natural disaster can come anytime. You have to prepare and on toes on 24/7s. That's the and preparedness is the main key for this thing.
Absolutely. I think that is so remarkable that what you've said, that preparing is very important step as
Hmm.
well. So now, trauma cases also represent a significant portion of emergency care.
Definitely.
So what are some of the key challenges in trauma management in the ED, and how have advancement in trauma systems and protocols impacted patient outcomes?
See, the trauma patients is the major junk who are causing morbidity and mortality in our society. Road traffic is very much increasing, and for that, the few we have heard in a medical term, there's a dictum of golden hour, the first 60 minutes of the trauma patients. Treatment to identify the what is the injuries, give the appropriate pain management, and give the get the evaluate what the injuries are there, and start the treatment in that. So in that 60 minutes, you do all the summarize the things. You have to make a protocols, you have to pathways, getting the if it is a road traffic accident, head injury, get the CT scan within 60 minutes, and get the treatment started there to prevent all the ultimately the morbidity and mortality of the patients.
Right.
And you have to align with all the other team members as well also, like a radiology team, ICU teams, surgeons teams, OT team. You have to align each and every one, even require a blood transfusion as well also. So by using the advanced digitalizations and all the systems, we have very much increased the getting evolution of the treatments in within the 60-minute spans of that.
Yeah, it is such so incredible to see how advancement are actually shaping the outcomes. And I also feel that you rightly mentioned that multidisciplinary approach of the
Yes,
team is
absolutely.
also really important.
Yes, yes.
So now, again, I would ask the next question is emergency medicine requires a wide range of skills from trauma
Mhm.
care to managing life-threatening medical conditions. So, in your experience, what gaps exist in the training of emergency physicians, and how can training programs be improved to better prepare future professionals for the challenges of the ED?
Definitely, definitely. So the main challenge is the staffing shortage, capacities, and awareness in public. Just if I give an example of that, a patient having a working in a home and having a cut and a bleeding is there. maybe the bleeding is much increased there, then you have to reach to the appropriate hospital where emergency physicians are available. Even like a stroke symptoms, patient having a one-sided weakness, and you are reaching to nearest hospital where don't have an emergency department or diagnostic facilities or the treatment is available, you are losing that particular golden minutes or the few initial minutes. So in that, the trained physicians, emergency physicians are filling the gaps in healthcare to come out of this morbidity and mortalities. Like in a chest pain patients, should be there should be ECG within 10 minutes of chest pain patients, and start the treatment as early as possible. 30 minutes, the thrombolysis time, the universal benchmark by the worldwide. So in that time, you should reach to that particular areas where the treatment is available and diagnostic facilities are available. Once you reach there, the treatment will start smoothly and you will have less complications.
Mhm.
Where actually this kind of courses, the awareness in publics, and then the bridging things in to prevent all this morbidity and mortalities in our things.
Yes, I think it is actually very important perspective that you've highlighted, and I think bridging these training gaps would certainly also empower the next generation of
Absolutely,
emergency physicians,
absolutely.
especially when they have to actually work under such high under pressure all the time. So it
Yeah.
would be really
So
important.
yeah, it's not a one day process, it's a continuous process.
Exactly.
And then how you prepare, you are preparing for your next future for next 10 years. And how you, the emergency departments, you go to grassroots level, the villages, where actually we are not able to provide this such kind of key treatments with them. So
Yes.
once this kind of courses are available, we can breach these things and commit out all the prevent morbidity and mortalities. Nowadays the road traffic accidents are very much increasing, and the young mass is being getting ill because of the road traffic accidents. If the courses are available, the bridging pathways are available, where the facilities available, we can save their lives.
Yes, absolutely. And I think that is such incredible work that emergency physicians are doing all
Yes.
the day. So now, finally, doctor, what advice would you give to healthcare professionals working in the emergency department, especially those facing high stress situations, burnout, or even challenges in managing complex cases?
Uh, First of all, complex the shift change because emergency department opens 24 by 7, 365
Right.
days. So you have to be on the shift duties. There is a major drawback for the all the emergency physicians. Maybe there's a like a less sense of private setup or the recognition sometimes as well also for the physicians. But I say it is one of the secure job in medical professionals where
Oh.
every time the emergency physician job is available everywhere.
Mhm.
So that is the thing, that is a good positive approach in that is. Even nowadays, to improve the particularly emergency physicians or the emergency services department, there are other resources are available like AI in a using of the AI in emergency department, telemedicine as well also, and empowering the nursing as well also to prevent this all burnouts, the bridge gappings, and for the future of the emergency departments to empower the other resources, so increase you support you in for future care.
Yes, actually, thank you for those words of encouragement and wisdom, actually, Doctor. And I'm sure that they will resonate with many of our listeners who work in the emergency medicine. So, now as we wrap up today's session, it's been an absolute pleasure having you on the podcast today, Doctor. So,
Thank you
thank you
so
so
much. Thank
much
you
for
so much.
joining.
Thank you. Thank you so much. Thank you.
And thank you for sharing your expertise and experiences with us and covering such a crucial topic in emergency medicines. And to our listeners, thank you for tuning into this episode of MedSynapse podcast series. And remember, if you're a healthcare professional that's eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay safe and take care.